Namaste, my dear friends, and welcome to this talk that is organized by Center for Yogic Sciences, Aarupadai Veedu Medical College and Hospital in Pondicherry. And this talk has been organized in honor of the International Day of Yoga. At any point, if you are not able to hear very well, just send us a comment or so, and we will try to solve it as soon as possible. So I'm very pleased that Dr. Madan Mohanji had invited me to talk today on the topic of Yoga Cikitsa. I will start with a small prayer and then we will go into the talk. Om Sahana Vavatu Sahano Bhunaktu Sah Viryankaravavahai Tejasvinavadhitamastu Ma Vidvishavahai Om Shanti Shanti Shanti. Namaste, my dear friends, and welcome this afternoon for this presentation about yoga as a therapy. I've been asked by my dear friend and colleague, Dr. Balaji, to do the unthinkable, which is to offer a PowerPoint presentation on this. I'm not really used to this, but I have tried my best. So in case I don't match up to the standard, please understand that this is not usual for me. But anyway, the good news is that you will get to see a much more beautiful presentation to look at than my face. So we will begin, my dear friends, about this topic, which is the topic of Viniyoga Cikitsa, the yoga therapy approach in the Viniyoga tradition of Acharya T. Krishnamacharya and TKV Desikachar. So please let me know if you are able to see our slide. Just give a thumbs up so I can watch, and if you can see it, it's good. So the first thing I want to share with you is a small historical review of yoga, because yoga is not something that is very new. Yoga is something that is very, very old. Yoga originated in India in the pre-Vedic period, and it has been practiced since then for a very long time. And you can see that they are already mentioned in many Vedic texts very generously in Upanishads, in many Upanishads, both the important Upanishads as well as the lesser known Upanishads. And there is even a set of about 20 or 25 Upanishads that are actually called as the Yoga Upanishads. However, none of these texts were specialized in presenting only yoga as a subject. And this is where Mr. Patanjali comes, who is the first master who synthesized the yoga philosophy through one text and presented it through a text that is called as Yoga Sutra, that is considered as the ultimate reference for the yoga texts. Further, Yoga Upanishads start to manifest in the later centuries, where they were specializing in only the presentation of yoga as a subject. And that's why I said there are many Yoga Upanishads as well. As history evolved in India, other texts also evolved, such as the Hatha Yoga Pradipika, the Shiva Samhita, the Geranda Samhita, etc., through Shaiva sect that is called as the Natha tradition, who were Kapalikas, sages who lived close to the Varanasi, mostly area, the Varanasi, the Ganga area, but they were present all over India. And these texts also became a very important source of reference for yoga. And also, what is very interesting to observe is that there have been numerous commentaries on the Yoga Sutra that have been composed throughout the century, through the centuries of history, starting from the very first one that was authored by Veda Vyasa himself until more recent histories like Acharya T. Krishnamacharya, who authored a text called the Yoga Balli, that is also a commentary on the Yoga Sutra, that is the latest one that we know. So many of these commentaries on yoga, as well as these texts on yoga, they generously talk about the different purposes of yoga, which include yoga as a therapy and yoga as a spiritual evolution, spiritual transformation process. A lot of people nowadays, we think that yoga is different from yoga therapy. It's actually not, because even in the very beginning, the main purpose of yoga was to reduce dukkham. Dukkham is another word for suffering. So if yoga came to reduce dukkham, yoga is a therapeutic approach. The reason why some modern people don't understand this and think that yoga and yoga therapy are separate is because many of these modern people, they look at yoga as asana practice only, stretching the body into different positions. That is not yoga, that is just one small part of yoga. So having said that, these things lead us to the question, what is the three purposes of yoga originally? And when you look at the three purposes of yoga, the title is a bit wrong, sorry about it. The title should be the three purposes of yoga. We have this as Shikshana Krama, that is for health, Cikitsa Krama for healing, and Adhyatmika Krama for our spiritual evolution. Our spiritual evolution. These were the three main purposes for which yoga originated. And as you can see, from the very beginning itself, yoga has had an impact on the healing. So when we look at yoga as a Cikitsa, yoga as therapy, we have to understand that the yoga as a therapy has its origins already in the Yoga Sutra of Patanjali, because Patanjali talks about vyadhi, dukkham, etc. in the yoga philosophy as obstacles for our spiritual evolution. He says it's an obstacle for our spiritual transformation, and hence we have to address it in a very responsible manner and we have to really take good care of our health, because without good health as a platform, we cannot fully achieve our potential. And many other texts, when you look at Hatha Yoga Pradipika, for example, or Gheranda Samhita or Shiva Samhita, etc., when they talk about different tools of yoga like asana, like pranayama, like mudras and bandhas, they always talk about it as alleviating many, many illnesses. And that is why we have to understand that there is yoga is very much engaged in therapy, which is yoga chikitsa. Now, it's very difficult to give one word of definition for yoga chikitsa, but some time ago, my father and I sat together to define this for our students, where we define yoga therapy as an individualized process. See, the beauty of therapy is that we cannot offer therapy to masses, to groups, the same thing. So that's why yoga therapy and yoga itself in the original days were taught only one to one. They were not taught in groups. This group classes of yoga is a very modern phenomenon and is less than 100 years old. Before, there were usually the teacher and the student one to one, and that is why it's called individualized yoga therapy. And it is a self empowering process which is very, very important. You cannot remove the word self empowering. In yoga, we have to take responsibility for the healing. We cannot expect somebody else to heal us. When we go to a doctor in the medicine, the doctor can do the surgery for us. But in yoga, we cannot expect the teacher to fix our problem. We have to put together our practice so that the disease can be alleviated. So that's why yoga therapy is a self-empowering process where the care seeker, we use this word care seeker, we don't want to use the word patient. I'll tell you why a little bit later. Where the care seeker, with the help of the yoga therapist, implements a personalized and evolving yoga practice. This is very important, personalized, because of the connection to the word individualized practice that not only addresses the illness in a multi-dimensional manner, but also aims to alleviate the suffering in a progressive, non-invasive, complementary manner. We'll come to all these points in a moment. And depending on the nature of the illness, sometimes yoga therapy can be helpful as a preventative methods and sometimes as a curative method. But in some cases also where the cure is not possible, we can also have it can facilitate in managing the illness or healing the person at different levels. Per healing the person at a different level. For that, we have to understand something about how we see disease, how Western medicine sees disease, and how yoga sees as health. Disease is viewed as a disharmony or imbalance between the different layers of the body or of the three qualities called Vata, Pitta, Kapha, or Sattva, Rajas, and Tamas. And health is defined as not only a balance between this, but more importantly, it is viewed as the full and successful expression of one's true potential. This is very significant, my dear friends, because in yoga therapy, we are not only looking at removing the symptoms of disease, but we are actually allowing for the person to express their full potential. That is when yoga therapy is a success. Think about it. When you have a plant like a tomato plant and it has no disease, but it's not giving any tomatoes, it's not considered healthy. It may have no disease. The leaves may be very green, the roots are very clean, the leaves are very clean, but there is no tomatoes coming out. That is not considered as healthy. It is still considered as something that is not yet realized its potential and therefore sick. So that is why in yoga also we see that disease therapy is not just the absence of symptoms of sickness, but also expression of one's potential. When you look at this, some key aspects of the therapy in the tradition of Viniyoga I want to share next. First and foremost, like I said, yoga is a self-empowering process where we have to put together the practice and practice it sincerely with lot of diligence and lot of discipline. Nobody else can do asanas or pranayama so that we feel better. We have to do the practice so that we feel better. Yoga therapy is holistic and multi-dimensional in its approach. So, you see, in Western medicine, normally people look at disease in only a materialistic manner because they're looking disease only through the form of the body. And of course, in psychiatry, they consider emotions, but that's about it. Whereas in yoga therapy, we are looking at the body as made up of multiple dimensions like Annamaya, Pranamaya, Manomaya, Vijnanamaya, Anandamaya, where all these dimensions are interplaying in not only the creation of illness, but also in the alleviation of illness. So sometimes we are not only looking at the disease in this holistic manner, but we also engage with choice of practices in a holistic way where we can integrate asana, pranayama, mantra, meditation, all these together. We'll come to all these tools of yoga a bit later. And when you look at the holistic approach, you will see that no two people are the same, neither in the body level nor in the other dimensions like energetic dimensions or intellectual dimension or emotional dimension or even in the spiritual dimension. We are different in each of these dimensions. Therefore, we have to focus the therapy individualized in a person centric manner, not necessarily in the form of just the symptoms of the disease or the name given to the disease. In yoga therapy, we are not fighting with the disease, we are working together with the practitioner. This is a very important difference between medical science and yoga. In medicine, they are fighting the disease. Whereas in yoga, we are working with the individual going through the disease, because if the individual feels better, even if the symptoms of the disease is not reduced, the person we are still helping alleviate their experience of the illness. Another important aspect of yoga therapy is that it is non invasive. We are not using any external instruments like a surgery knife or a scissors or even medical pills and things like that, nor are we using hands or needles and things like that that they are using in massage therapy or in acupuncture, etc., to take an invasive approach. In yoga therapy, we are using the body's own resources to deal with the illness. We are not using external interventions. We are using body's own resources. And that is why it is called as a non-invasive approach. Yoga therapy has one weakness, you can say, or you can say as a strength, that it is an evolving process, not an instant solution. If you look at Western medicine, it is very instantaneous. You can take a pill for your headache, and in about 20 minutes, your headache disappears. There is now a lot of advertising I have seen in America, what is called same day surgery. You admit yourself in the morning in the hospital, you get your surgery done in the morning, you rest for a few hours, in the evening you are discharged and you are back home. It's instant. Next day you don't have the disease, you don't have your hurting appendix, etc. But in yoga, it's take time. The first practice will bring some changes, which will lead us to the next practice, which will bring us further more changes, which will bring us to the next practice, etc. It's not instantaneous, but this has an advantage because if we do it this way, then it is sustained longer. We don't lose it as quickly as we gain it. So this may be the only disadvantage or advantage of yoga as a therapy, depending on how you look at it. For somebody in a hurry, this may not be an advantage, but for somebody who has patience, this may be an advantage. What are the salient features in the Viniyoga tradition? Like I said, it is a self-empowering process. We only teach yoga in an individual setting for yoga therapy. We don't teach people in groups. It is multi-dimensional in the approach where we are using multiple tools in this. We are not focused on the symptoms of the disease, rather we are focused on the individual so that the individual's experience of the disease can change. And this will allow us to respect the individual's context, such as age, occupation, family situation, job situation, and other parameters which we will have to consider, which we will discuss in a moment, and as an evolving process, not as an instant solution. So these are some of the key points, and most significantly, we are not just looking at disease as a set of symptoms in the physiological dimension, but we try to bring out personal and spiritual development to fulfill the best potential of that person, where the therapy must help develop the unique strengths each of us have. We all have unique strengths, which is what we have to bring forward. And lastly, we have to understand that yoga therapy is a complementary approach and not a supplementary approach. In many cases, we will see that a person may need to take more than one system to help them overcome their problem. So, we never ask people to substitute Western medication or allopathy with yoga. We tell them continue your allopathy and can start your yoga, and let your allopathic doctor decide when you should reduce your medication or when they should make changes in the intervention plans. That is not our job, that is the job of your doctor. So this is basically what we do. So then comes the idea of what is yoga as the therapy, the framework of yoga as a therapy. This is presented in the Yoga Sutra second chapter. A four-step model is used, which is called as the Vyuha model. We don't need to worry about it. Some people may know this from the Mahabharata. Chakra Vyuha. Vyuha means an arrangement. So the idea is that yoga therapy has a framework, a set of four steps. The first step is Heyam. Heyam is identifying and accepting the symptoms of the disease. If you don't accept the symptoms of the disease, how are you going to deal with the disease? So that's why we need to understand that Heyam is the first step. Accept that you have a problem. Many people, they don't accept their problem, and that is the big problem. Now, once you have accepted the disease, in the yoga's theory, a disease is not there by random. The disease always has a cause. And that is what is called as Hetu. Hetu means establishing the cause or the origin of the illness. The cause or the origin of the illness. The next step is identifying both the short-term goal and the long-term goal. And in some cases, only the short-term goal may be possible to identify, because there may be layers of illness that somebody can have. So that's the third step, is to determine what is our immediate goal and what is our long-term goal, if it is possible to know the long-term goal. The last step is upayam, the establishing the tools or the means to reach the goal. What is it that we need to do to reach the goal? That is called upayam. So this is the basic model. We will try to understand this in a little bit more deeper. In the yoga philosophy, when you look at Patanjali's Yoga Sutra, he presents the symptoms as a list of many of these possibilities. We have dukkham, emotional suffering. We have daurmanasya, negativity in the mind, pessimism. This is also a sign of illness, emotion, psychological illness. Angamejayatva, this is where the physiological imbalances manifest. We have heightened heart rate, or blood pressure is high or low, or fever, or pain in the body, muscular tension, ulcer. All these are physiological imbalances. Shwasa prashwasa, disturbances in the breathing pattern. Disturbances in the breathing pattern. See, already you see how the symptoms itself is on multiple dimension, not just in the physiological dimension. A lot of people think that disease only is physical, but whereas you see already in the first four, you have emotional suffering, intellectual suffering, physiological suffering, and disturbances in the breathing pattern. Apart from that, we may also have a collection of symptoms that defines itself as one name called disease, vyadhi. And we have many diseases like asthma, like hypertension, like cancer. You have certain diseases that manifest as well, which are basically a collection of a certain set of symptoms that are given particular name. Styanam also is considered as a disease because it's an obstacle. Mental stagnation, when your mind is very dull and heavy for a long period of time, not for an hour or two, but for months or weeks or things like that, that's considered like an illness as well, one of the symptoms of illness. The next one is samshaya, doubt, confusion, lack of clarity. All these are considered to be also signs of disease, because when we are healthy, we will have clarity and confidence. We will not have doubts, confusion, or lack of clarity. Hasty behavior. When we are healthy, usually all our actions will be measured, will be deliberate. We will never be in a hurry. Whereas when there is disease, this will not be the case. Disease will make us rush, wait for the last minute, and then rush, and then create more complications. Alasya, laziness or sloth. Again, not lazy for small things, but long-term laziness is also considered like a symptom of disease. Avirati, addictions or obsessions that many of us go through. We have now digital addiction. Before digital addiction, it was alcohol addiction or drug addiction or things like that. That is also considered as a symptom that something is not right in our system. Bhranti darshana, distorted perception. You see how sometimes when we are living in an alternate reality, we're not living in reality, we're living in an alternate reality, that is considered as Bhranti darshana, also another symptom that something is not healthy or stable. Then comes alabdha bhumikatva. Alabdha bhumikatva is lack of perseverance. We don't give enough energy to the things that we have to give. We don't give enough energy to the things that we have to give. We are not able to sustain our dharma. We start, we stop, we start, we stop. We don't sustain. There is no perseverance. Anavasti tattva, we reach our goal, but we don't sustain it, we collapse. Like many people come to me, they want to get reduce their blood pressure. They start doing some yoga for 4 or 5 days. Their blood pressure drops. Then immediately they stop. They're not able to continue. Then once again, the blood pressure goes up. People come for weight loss. They lose about, they say, oh, I want to lose 2 kgs. And until they lose the 2 kg, they are very disciplined in the practice, in their diet, etc. But the moment they have lost the 2 kgs, they are not able to sustain. They are not able to hold on to the gain. They lose track. These are all considered as symptoms of disease, of something that is not going well in our body. Now, what causes these things? There are many, many different causes according to yoga philosophy. Some of the more important things we are listing here. Avidya, we don't have clarity, so we engage in something that disturbs our health or our life situation. So we eat something without knowing what is in it, or we live a lifestyle without fully understanding what is the appropriate for our body, etc. This is what is called avidya, non-clarity or non-knowledge. We all have been victims of this one point or the other. Then comes asmita, egotism or inappropriate identification. Sometimes we do things because of ego, prestige, status, and they create illness. They create illness because we push our body beyond what it should be just for the sake of ego. I don't know if this still happens, but in the past, about in the early 1900s and also late 1800s, people were wearing very tight clothing to make themselves very slim, or were wrapping their feet so tightly to make the feet smaller, or they would wrap their head so that they extend their skull in a certain shape, etc., just because of the narcissistic idea that small feet or a big skull, etc., were considered to be very pretty and fashionable at this time where they were living. That is asmita, creating disease. Raga, we like ice cream and we want to eat ice cream every day. It creates sickness. That's why in each of our families, we have to have a controlling officer who checks how many ice creams we are eating each day or each week so that we don't fall sick. So this is raga. Dvesha, aversion. Sometimes we are doing things out of hatred. For example, let's say if your mother or father, you don't like, you have some problems with them. So just because you want to irritate them, you want to do something that irritates them, like go and drink alcohol or go and smoke cigarettes and things like that. That's aversion created problems. Fear can create illness. Change can create illness. Seasons change, our bodies change, our circumstances change, but we are not able to accept it. We fight it. We don't want to recognize the change. That can create problems. Expectation. We expect something, but it doesn't happen. That can create psychological illnesses. It can create emotional illnesses, etc. Habitual patterns. Sometimes we get used to something and we continue that, and then that creates a problem. In India, there are many, many rituals, for example, with fire that people are supposed to do for the gods in the house. And so we try to we try to do that, we get used to it. But then let's say we develop some breathing disorders because of that, because every day we are in the smoke, and maybe our lungs and breathing capacities are not so strong. So it creates a problem because of habit. Every day we are in the smoke. Bad diet, ayukta ahara, inappropriate diet, ayukta vihara, inappropriate lifestyle, asat sangha, inappropriate company of people, gunavritti virodha, disturbance of the gunas, prajna parada, we know but we still anyway do the mistake that is called prajna parada. So all these are basically the causes of illness. When you look at the goal, the third step is goal. We need to achieve certain things like emotional wellness, what is called sukham, saumanasya, a positive mind, angasthirya, uh, the what do you call the stability in the body, physiological stability in the body. Dirgha Sukshma Prana, long and smooth breathing pattern. Samatwa, equanimity. So, no matter what happens, we are not really getting provoked. That's the called samatwa. No matter what happens, we don't get provoked or disturbed. That is called samatwa. Swastha, overall good health where we are established in our true nature. This is called swastha. Now, the tools that yoga are presenting is the very famous Ashtanga yoga and other things as well. We have yama, we have niyama, we have asana, we have pranayama, we have pratyahara, we have dharana, dhyanam, samadhi as meditation, we have mudras and bandhas, we have nyasa, we have mantra japa, swadhyaya, self-reflection, dietary changes, lifestyle choices, correct lifestyle choices. That's why I told you yoga is a holistic package. So we need to consider all of these when we want to consider yoga therapy. Yoga therapy is not only through asana. That's the biggest problem. And it's unfortunate that many Western organizations who are trying to control yoga therapy strictly focus only on asana, and they are doing a great disservice not only to yoga but also to the students, because that is not the appropriate manner to deal with yoga therapy. When we implement the tools of yoga, we have to consider different parameters. I told you earlier that we have to consider the context sensitivity of the person. So we have a lot of these parameters we have to consider. It's not just that everybody will be given the same kind of tools. We have to consider what is called prakriti. We have to consider vikriti, constitution, and how the constitution exists in the modified state. It's not always that the constitution exists in its natural state. Disease is considered an altered state of our fundamental nature. Then we have vasanas, impressions like trauma leaves an impressions, bad experiences leave us impressions, these kind of things that we are carrying in ourselves, both from our life and our ancestors. That is called vasanas. That is also something that we have to consider. Then we have to consider kala, the time of the day when the person will practice, the time of the year when the person is practicing this, etc. Desha, the environment, the place, whether it's a high altitude place or a sea level place, etc. Or how much space a person has to practice, etc. All these are considered as desha. Then age of a person, what stage of life they are, dependent on the age. That is also important because the gunas which are dominant will change over time. Then vritti, the activity or the occupation of the person, because occupation also leaves impressions. An emergency worker in the hospital as a nurse, even though she does not have any trauma herself, just because she's dealing with traumatic patients every day, that can leave impressions because that is her job. So that also we have to consider things like that. Shakti, the capacity of a person at the physical level, at the mental level, at the energetic level, etc. And another thing is, what is the path of a person? In traditional times, there were something called marga, the path that a person followed. We don't have that nowadays so much because we just are rats in a race. But in the ancient time, people had to consider the marga, the journey of a person, the goal of a person. Now, in general, now where yoga therapy can assist are certain kind of domains that are common now. It's not the full list of illnesses where it can assist. We can help in musculoskeletal system, the illnesses of musculoskeletal system, respiratory illnesses, lifestyle related disorder, stress related disorder, challenges during pregnancy, post surgery. For example, people can recover from surgery as well. These are common areas where it is very helpful. And also certain kind of mental and emotional conditions, except when it is so severe that the person cannot empower themselves. But all this is usually areas where yoga therapy can commonly assist. There can be some other examples apart from this list, but these are the most common reasons why people come to us for yoga therapy. Where yoga cannot help, coronavirus, for example, it cannot remove the coronavirus problem if somebody is affected, because communicable or infectious diseases function based on virus or bacteria and things like that. And that is where yoga cannot cure them. But we can make the immune system stronger so that the person is not actually affected by them or is able to recover quicker, but it's not possible to cure this. Life threatening illnesses like cancer, HIV, etc., yoga cannot cure, but it can help in management of the person's experience of the illness. It can improve quality of life of the persons who are going through this, and therefore in some way heal the person. But it's impossible to cure these diseases purely with yoga as a therapy compared to, let's say, a back pain, which is what was there in the previous slide. Certain irreversible diseases like Alzheimer's, dementia, and even some forms of amnesia, it's not so easy to help with yoga therapy. Severe mental and emotional disorders like very, very heavy depression or schizophrenia and things like that, it's not possible to make a statement that this will definitely help. It's impossible to make such kind of statements. And also in conditions where the care seeker is unable to empower themselves, like for example coma state or state of extreme laziness and things like that, where they cannot empower themselves, like mental retardation, children with special needs or special capacities, it's impossible to help. That's why when you consider all these factors, we need to develop a strong sense of competency in the yoga therapist. And that is what is a big challenge today, because everybody seems to claim themselves to be a yoga therapist, and there is not a proper body yet that regulates yoga therapy. I'm very happy to say that now through the Indian Yoga Association, the IYA, we are working together to develop these kind of competencies. And I think when it will be ready, it will be pioneering and groundbreaking. Many other organizations outside India now who claim to be yoga therapist organizations, they are really not very good in their competency list, nor are they qualified to create these competencies. Because what is needed is a very thorough knowledge in yoga's fundamental theory, because yoga's tools are based on yoga science, not modern science. That's why you cannot get a bunch of medical doctors to decide what is yoga therapy competency, because they don't have a clue about what is yoga theory and what is yoga's philosophy, which is created these tools. And we also need to have a lot of knowledge about the allied systems such as Ayurveda, because yoga and Ayurveda are sibling disciplines, and it's very, very important to know both in order to practice yoga or Ayurveda, because they share common understanding. And in the old days, that's how the scriptures were. Because it was discussed here, they don't discuss it here, because they assume that the person will know both. these things. And some amount of modern biomedical and psychological psychological systems is also needed. But what is most important is observation of the person. And that is where yoga therapy is so remarkable, because it has remarkable ways to observe a person without medical instruments. We are not putting a person through a microscope or an ECG machine in yoga therapy. We are using our own resources like eyes, nose, etc., hands to feel the nadi of the person, etc. And these are all important tools in yoga therapy. So knowledge of this is very much needed. That's why I say modern organizations that are coming from many different Western countries, they don't have this skill. That's why they are not qualified to be talking about yoga therapy at all. And how to apply yoga therapy, that is also a competency that we have to develop. We have to develop research minded documentation. So the person must also have the capacity to document properly what they are doing. And also, they need to have a professional practice where they can actually set some professional boundaries where they practice yoga, because there has to be clarity in boundary. We cannot mix too many things. Some people do yoga therapy and Tibetan singing bowl. Some people do yoga therapy and massage together. Those create a lot of confusion, and these must be avoided. So there must be proper boundaries to handle this. What are the challenges facing the yoga therapy today? Problem is because there is inconsistency in definitions, frameworks, and practices. There's a serious lacking of long-term educational programs, because all the competencies to develop requires a lot of time, whereas people nowadays are in a hurry. And if you are going to be in a hurry to get a certification, it is not going to be helpful. So we need to have a long-term educational program that teaches all these in depth. The public perception of yoga is viewed with skepticism, especially because of these previous factors that I've told you, because there are too many people claiming to be yoga therapists with very little knowledge. And that is why people are also skeptical about yoga as a therapy. Yoga therapy requires a lot of studies and clarity, and that is when people will start looking at it with respect and dignity it deserves. Another big challenge is a lot of yoga therapy is offered in group session rather than one-to-one classes, and this can be quite dangerous because the same technique will not work for everybody. And it's very difficult to do research when you are not standardizing the technique, because the modern scientific approach is a very fanatic view. It's this double blind method or no other method. They are not very open to this, but maybe we can take other scientific methods which don't involve standardization of technique, but maybe standardization of process, and then present more and more research that will be opening the doors to yoga therapy in the hearts of all the people. And the last big challenge is laziness, because people have gotten used to other self disempowering frameworks like medicine, like massage, like acupuncture, etc., where somebody else is solving their problems. The people continue their own lifestyle. Yoga requires a change of lifestyle, a change of diet, a daily practice, etc. And people are too lazy to empower themselves in this manner. So that is the big challenge that we are facing in yoga. So this is basically the presentation I wanted to do, my dear friends. And I think, Dr. Balaji, I have promised you that I will not be more than 1 hour. So there we go. We have any questions, you are free to ask, or
Sir, thank you, sir. Thank you very much.